Now we continue this discussion with Dr. Gilbert Burnham. He's the co-director for Center for Refugee and Disaster Response at the Johns Hopkins University, and he joins us from Baltimore, Maryland. Dr. Burnham, welcome to Arise America. Thank you so much for taking a few minutes with us. I do appreciate it. I know that you're aware of this proposal that has been set forth, or not proposal, plan that has been set forth by the president to help mitigate this Ebola crisis. Is it sufficient?
Well, I think it's a good start. And I think this will have to be tuned as we go along, and there'll be new needs and new realities show up, and we'll have to respond to those.
Can you put in perspective this Ebola outbreak? There have been several others over the past few decades. Where does this fall in perspective to others?
Oh, this is by far the worst, and it's by far the worst because this is the first time we've seen Ebola really appear in such a deadly manner in urban areas. And I think once it gets established in urban areas, then the death toll and the consequences are going to be unimaginable.
And you said that this is a good start, and of course the president has proposed a number of key initiatives, opening up 17 treatment centers, training 500 workers a week, of course sending 3,000 troops to address this. However, this outbreak has been going on already since March, so for several months, and most of these initiatives will take time to fully implement. Are you concerned that this Ebola outbreak can't be contained fast enough?
Well, I think we'd all always like to see things happen sooner than they do, but I think this is a very important step, and we have to remember that many times it takes international bodies a while to get organized and to get the support and so forth that they need for these situations. And I don't think until fairly recently we've really appreciated the severity of things. So there's been a lot of criticism of World Health Organization, of other organizations for being slow in responding. And I think that now the action with the CDC and the U.S. government is another step in speeding this up and hopefully being able to contain this outbreak more quickly.
I know that this is speculation on your part. There's been more than 4,000 cases of Ebola. Half of those have resulted in deaths. How bad might this outbreak get before it finally plateaus and hopefully levels off and declines?
Well, first off, we have to say that it's likely that more than 4,000 people have died, and our ability to keep track of this number in these situations is not very good at all. A lot of people have died kind of off the record. How far it's going to go, I've not done any type of mathematical modeling. There's been a prediction by the World Health Organization that it might go to 20,000. It could easily go beyond that.
Is there any threat? Well, I suppose anything can happen, but how concerned are you that this might turn into a pandemic and become much more widespread?
Well, there's that concern, but I think that taking quick regional action, as has been proposed and as is being done, can limit this. But this is not going to make Ebola disappear from the planet. We're likely to see it back. And what I'm hoping from this is that we can learn the public health and the management lessons that will help us next time that this happens, that we'll be better prepared and we won't see this kind of exponential rise as we have now.
Very briefly, Doctor, before I have to let you go, how encouraged are you about this experimental treatment that we've heard about, ZMapp? And of course, part of the president's plan is to fund 2 possible candidates for vaccination. Are those encouraging or still way down the road?
Well, I think that that work toward a vaccine is very important. I think treatment is very helpful, but this is going to be solved by basic public health methods. It's going to be solved by finding contacts. It's going to be solved by dealing with people who have been incubating the disease. It's going to be dealing with the consequences of death and the spread of disease. And so these other things will help, but this is basically a public health battle that we have.
Dr. Gilbert Burnham, thank you so much. Appreciate it.
Thank you.